Awesome. Thank you all for joining today. My name's Jody Mitchell, and I'm the Senior Director of Government Relations and Policy here at the Center for Health Affairs. We have the privilege of convening the Northeast Ohio Opioid Consortium. And so part of the Opioid Consortium is to hold educational events and trainings for the community and for clinical providers. And so this is one of those opportunities. Many of you may have attended our September forum. We had an in-person roundtable event, which was great to hear from the community, all the good work going on. Today, we're going to be talking more about communication and engagement and how we communicate with individuals that have either have substance use disorders or are in recovery, and just how we can be more effective in how we communicate to individuals. So we've got a great panel today. I am pleased to have Karen Snyder from Second Act serving as our moderator. We have Charles Sackman, who's a person in recovery, to share his experiences. And it's really great to have that lived experience perspective. Ashley Rosser is a harm reduction educator for Thrive for Change, and she's also the founder of the Facebook group Ohio Harm Reduction Alliance. We were going to have Amy Scheidemantel from Metro Health System, and unfortunately she came down with the flu this morning. So we wish her healing wishes. Dr. Bascaro is here. He's the chief psychologist at Behavioral Health Institute at Summa Health. So thank you all very much for giving your time this afternoon for this important conversation. This one will be more conversation and dialogue rather than a presentation. We are recording. Many of you may have gotten that pop-up that we are recording. We do record our educational series and we post them on our YouTube channel so that they can be accessed as education opportunities in the future as well. So we'll have that recording available. So today, as I introduced this panel, I'd like to really turn it over to the moderator, but first I know she's gonna engage with our panelists, but I'm gonna ask the moderator the same question. Why is this topic important to you? Tell us a little bit more why you want to help people communicate better regarding substance use disorders. Karen?
Sure. As someone who has lived experience and is in recovery, I think this conversation is very important. There are a lot of layers when someone has substance use disorder, and how to navigate getting help and how to talk with someone, when that person is ready or maybe not ready to get help, I think is an important conversation to have.
Great, we appreciate that. If you'd like to go ahead and engage with our panelists, and I will help with the slide deck. Thank you, Karen.
Okay, great. So thanks everyone so much for being here. So this panel is put together through the U.S. Attorney's Office, Northern District of Ohio, Heroin and Opioid Action Plan Prevention Education Subcommittee. And our subcommittee throughout the years has put on different panel discussions for the community around prevention of substance use, harm reduction, treatment, and recovery, to have these conversations with the community. So, yeah, I'm gonna put that question onto our panelists. Why do each of you feel that this conversation around substance use disorder is important to each of you? And I'm going to start with Charles.
Thanks, Karen. Hi, everyone. My name is Charles Sackman. As has been mentioned, I'm a person in recovery. anytime I have an opportunity to get involved with conversations around recovery, I think it's always important just to thank the organizers for including me. I think that part of my continuing recovery is doing this really important work to try to provide as many different pathways to recovery for those that are still out there suffering from substance use disorder. So, and I think that keys into what is so important about having this conversation. There's just something unique about people that are suffering from substance use disorder as you would compare it to other kinds of diseases or health issues. And so getting some really some good strategy around best ways to approach those people, how to have those conversations, I think is really impactful towards the ultimate success of getting those individuals the support that they need. And I think that this is an issue that touches just about every person that you'll come into contact with, whether directly or indirectly. So, having this conversation, I think, is so instrumental in trying to chip away at this problem.
Thank you so much. And Ashley, why do you feel that this conversation is important?
So I feel like there's a lot of people that are hurting right now. That's a pretty common theme in a lot of these conversations about substance use and engaging with family members, people who work in the field. The ripple effect is really extensive, and overall, there's just a lot of things that we can do to try to better streamline communication and give people actual tools that they can use to work on rebuilding the relationships that might have been lost, and really just strengthening the relationships we have with each other and even in our broader community.
Thanks, Ashley. And Dr. Biscaro, why do you feel that this conversation around substance use disorder is important?
Well, I mean, I think it's important for a lot of reasons. Obviously, as a family member who has seen kind of multiple family members go through, loved ones go through addiction, it's important. And as a professional, as a clinical psychologist, it's this is a matter of life and death, as I've said before, right? I mean, these are individuals who are kind of at their most vulnerable, who oftentimes are, as kind of Ashley pointed out, suffering and need compassion, support, and love, and help, to get them to where they need to be. And sometimes, right, they don't even see that. And so I think there's a lot of stigma, right, associated with substance use disorders, with behavioral health issues in general. And I don't know about you all, but the last time I checked, the best way to sort of circumvent or deal with that is to kind of call it out, talk about it, and address it. So for those reasons and really many, many more, I'm both pleased to be here. So thanks, obviously, to Center for Health Affairs for having us, and looking forward to having this dialogue again.
Thanks so much, Dr. Biscaro. Okay, so now I'm going to be asking some questions to our panelists about, we're going to start with Ashley. How do you feel that you can start a conversation with someone who is struggling with substances?
I think a really good way to open the conversation is to be really neutral about it. Don't make any assumptions, first of all, kind of check your own internal biases that you might have. But I would just like to throw it out there that what I've done in my own experience, as a person with living experience in recovery, and now I'm on the other side, being the one to be able to offer resources to folks working with people who use drugs. It's always been really interesting to see and hear people's reactions to asking them if they have Narcan on hand, which is the overdose reversal spray, because it's just something that you can ask anybody, regardless of if you think they're using or if they're confirmed to be using or a family member or just a concerned citizen. Like, that is something that you can ask anybody, like just across the board. And normally with the responses, you get a lot of answers. Like, people will offer it up and say like, well, I don't really need that anymore. So kind of giving the context, like they used to use drugs, or people just being like a family member, or people asking for resources after that. It just kind of opens up the door for the conversation in a neutral way, in a friendly way that takes the pressure off of them to like come up with a response.
Yeah, that's a great suggestion. And so what are some tips or tools that you have for building trust and, having a healthy relationship with someone, for example, like in your role as a harm reduction specialist, what tools do you feel are helpful to build that trust?
Honestly, it takes a lot of time to work on that. That's a big one. So having patience with people and showing them with your actions that you can be trusted and that you are listening to what they're saying. So like following through with the things that you're saying. And over time, like as the relationship develops, the conversations will shift. But at first, people are really, most of the time, guarded. I can't speak for everybody, but a lot of the times people are guarded. There's a lot of mistrust out there. So it really just starts with like having the conversations, but also not jumping ahead of the game at the same time. Using like motivational interviewing is something that I think is a useful tool that everyone can use in like every aspect of our lives. So not asking just like really general, like yes or no questions, but asking something that's more open-ended. So instead of asking like, did you have a good day today? Where they could just say yes or no, you can ask them something specific, like, what was something that you did today that you really liked? Can you tell me more about this thing that you did today? And it opens the door for them to actually have a response to that. So it's like little incremental baby steps, but I absolutely love motivational interviewing. And I think it could be really useful for everybody, regardless of where you work and what you're dealing with too.
Yeah, that's a great point, because like you said, it allows them to share more instead of just the yes or no answers. So what are some challenges that you have faced in your work in starting to engage with someone who may be struggling with substances?
Oof, there is a lot of hurt that people have. They have been harmed. A lot of people have just previous trauma that they've had to deal with. And now it's like, I kind of got to work with people to peel back the layers there and really show them that I'm not going to harm them in the same way that they've been harmed. So it's like, I'm not just meeting someone and giving them supplies or giving them a phone number to call, but I'm also like having to figure out what their needs actually are, because some people don't want to talk about the things they actually need right away. So I guess it's just the general mistrust that people have is really a barrier. And it starts with people going into a system or a program and they have expectations, or the people that work in these programs weren't kind to them or stigmatized them either intentionally or unintentionally. And we really never know the impact that we're going to have. And that's why I always suggest to people that they learn about stigma, learning about stigmatizing language and working on our own internal biases, because even if it's not intentional, the impact is still there. It's still going to harm people. So that is a huge barrier that I see, is just people having general trauma and wherever they end up, like we're going to have to work with them to address that. And that takes a lot of time.
Absolutely. Yeah. Thank you so much. We're gonna move on over to Dr. Boscaro. So what resources and support systems are available to individuals struggling with substance use disorder?
Yeah, you're going to go to those slides, right? So obviously, there are a lot of resources out there, to help folks who are struggling. And I think, I obviously I don't know who's listening today, but obviously there might be a variety of individuals that hopefully listen to this over time. And it's really important to kind of just think about resources in a few different ways, right? You're going to need resources for when people are in an emergency, and we know about 911, and hopefully people now know about 988 that they can call during behavioral health emergencies. Basic needs, those are really important and an easy way to engage people, especially if they're not really willing to talk so much about their substance use issues, right? Treatment resources. There's a whole wide array and continuum of resources available in the treatment world, and people have to and need to be ready for that. Sober and recovery resources, supports, social and peer supports. And I've added a few examples here, but obviously there's kind of Google and street cards and a lot of that there's ample information out there, but some of the really good ones I've tried to highlight, at least in the local community. So, but I think really it's important, if you go to the next slide, as you think about like resources, it's important to really think about where people are in their readiness, right? Stages of change. A lot of people have heard about that. And I've listed for you the different stages of change, but obviously if people are pre-contemplative, right, they're not really thinking of taking any action around their particular substance use disorder. So why are we going to be talking about treatment things? We probably want to make sure there's not an emergent issue we have to deal with, or that there's not a basic need that at least will allow us to develop a relationship with that individual, right? People who are in contemplation, right? They're intending to make some type of change, just probably not sure how to do it yet. Preparation, or also now we're calling that right determination. People are ready to take some action. Research telling us like usually within the next month or so. And action, right? They're ready to go. This is when a lot of those kind of more intensive treatment resources are going to be probably the most useful. Not that we shouldn't try, but probably where we're going to expect people to stick around, right? So, is during this kind of action stage of change. And then maintenance, right? So there's been sustained behavior change for more than 6 months. And there's a lot of different ways to interact with people. I know we have some slides. We don't have to go through all those after this, but I think it's important to also understand that once you know where somebody's at, right? We talk about that a lot, where meeting people where they're at. Once you know where they're at in terms of their internal readiness for change, then you can start to intervene with them appropriately, right? If you know they're not ready to change, you're going to do, as Ashley mentioned, more motivational kinds of things, right? You're going to try to elicit change talk from them. What better way to get somebody to go to treatment when they said it themselves, like, I'm ready to go, versus you need to go, let's go, right? Kind of similarly, right? People who are in more kind of motivation stages, we used to call it persuasion. Now it's called like motivation. So these are the contemplative and preparatory kind of folks. This is where, again, more motivational interviewing, but you can start to suggest kind of things. You want to try to tip that ambivalence, right? And get them motivated and build their confidence to kind of follow up with some of those resources, right? We can give people a lot of resources, but ultimately, what do we want them to do? We want them to follow up with them. We want them to pick them up and use them. And then the next slide just talks more about kind of the action-oriented phases. So this is when these are people that are in active treatment, so in treatment programs. And then the next slide talks more about maintenance and relapse prevention. And even recurrence, right? So also understanding what our role is and how we can help and what kind of resources we need to provide when maybe somebody does start using again.
Yeah, that's wonderful. Those slides are very helpful. So something that I think is important for people who are navigators or community health workers, what's the best way to handle a handoff from a clinical provider such as yourself to a navigator?
Myself, sorry. I think it's really important. We talk a lot about in healthcare about warm handoffs, right? And what does that really mean? So that's really the best kind of handoff is a warm handoff. So in order to do that, you need to be available. In this day and age, you can be available virtually, but also right in person. There to make the connection, accompanying them to things, to resources, to appointments. Really as soon as possible too, right? As soon as possible to the event. We want that handoff to happen right at the time of referral and maybe at time of overdose or their expression of readiness. We've heard right, striking while iron's hot. That's a really big deal because there's a lot of ambivalence for a lot of different reasons and just a lot of fear. So the quicker that we can get things going, sometimes the better. And then really research has shown that those interventions, anything that we do, if it's on demand and rapid, that's most effective. And think about how our system is set up, right? You got to make a phone call, you're on a wait list, you may or may not talk to somebody. It's ludicrous, and so it's really not all that helpful. And obviously, if we can get people transportation, if we can, in follow up, we want to know what the navigators are doing. I want to know if the navigator was successful in connecting someone somewhere, if they're having difficulties, how maybe I can help in the clinical work that I'm doing with that individual to maybe facilitate follow up and things like that. Those are just some thoughts.
Yeah, that's very helpful. Going back to the slides, when someone is in the space where they're ready to get the help, do you feel as though that is considered a crisis situation because they're at that point where it's imperative to get them the help that they need at that time?
Yeah, crisis is kind of defined a lot by the individual, right? And so could be, it could be if they have nowhere to go, they have no support, no one to lean on, and they're thinking about ending their lives, right? That could be an emergency. That is an emergency. And so we have to, initiate the appropriate response for that. But, it may not be, depending on, like I said, if they're ready to change, but they have supports, they have a place to stay, they have some things to sort of help them, quote unquote, wait for whatever it is that they're going to be engaged in, then we're going to be a little less concerned.
Right. So yeah, connecting them, for example, like to treatment is, a way to support them in their time of crisis. What are some other tips of how to support someone in their time of crisis?
Well, it varies, but I think that obviously, being there, being supportive, helping them if they don't already have a sponsor, helping connect them to those, not necessarily a sponsor, but sober supports. This is where peers can be really helpful. This is where folks like Ashley can be super helpful. Those types of resources to kind of help, anything to sort of help keep them alive and well until they can get the help that they need is kind of like what we want to be doing.
Yeah, that's great. Thank you so much.
Mhm.
So we're gonna move on over to Charles. So as a person in recovery, what kinds of outreach were instrumental in your decision to seek recovery? And then also what external forces, helped guide you to seek recovery?
Yeah, thanks, Karen. For me, a lot of it had to do with a very supportive family. I was fortunate where, like many people that have kind of been through the battle with substance abuse, I had multiple stints in like a rehab, outpatient situation. So my mom had gotten involved through that with some support for like family members of people that are addicted, and through that, these kind of 12-step support groups for people that don't have substance abuse but that are living with someone that's either a family member or a parent, or a child. She learned some really helpful skills of how she can better approach me, and so the timing just kind of came together, right? I was in a place where things were bad enough for me where I was willing to look at an alternative, and she gave me an ultimatum, and ultimately it was up to me to make that choice of, it's time to address this head on. It's time to take that step towards, getting back into a rehab program and take this seriously. So I think, looking at like what Dr. Biscaro had shared, I was at that point where I was ready to take some action. And it was with the right external stimulus that I was able to move in that direction. But I think something that's so important is, there were multiple points of contact I had leading up to that with the recovery world, with sort of being faced with continuing to stay on the path that I was on versus trying to do something about it. And so I think that's also something that's really helpful to keep in mind for folks that are on the front lines and having these conversations. That problem's not going to be solved then and there a lot of the time, but it can serve as, that, I guess, education of now this person knows where to go when they're ready, right? And so I think that's really important to highlight, and I think it's an important expectation to have for those folks that are having those conversations is, what does success look like, right? And sometimes success looks like just being a really good listener, letting people know what the resources are, and understanding that while they might not be ready then and there, you are letting them know where they can go when they are ready. And so I think for me, it was sort of the culmination of that in my life. I knew where to go when it was time to be, to get help, and I finally was ready. I got a little bit of that push from a parent, and then I finally got in the direction of doing something about it.
Yeah, I do think that having someone that you know that is, seeking their own support, like you had said, your mom was seeking help for being a family member who was affected with her son's substance use disorder. Ashley, since you're also a person of recovery, I just want to ask you that same question of what kind of outreach was important in your decision to seek recovery.
Oof, it was actually after like years of failed attempts. And I can really relate to Charles. I had, I still have a partner that was really supportive and didn't like try to ice me out or like threaten me, but set some loving boundaries at the same time. Like there's a lot of harm being caused from his end. And he told me how the impact was affecting him of my substance use. And he really showed me some pretty harsh realities. Like, there's just a lot of stuff going on that, you know, he can't deal with, and I was causing him harm in the end. But he was also concerned for my health and well-being. He was present for my last overdose, actually, and there's no words that I could ever like try to articulate and express how that feels to his perspective. You know, finding your significant other, you know, overdosing is really traumatizing, and that's something that I don't have any recollection of. That's something he will have to live with for the rest of his life, and me knowing that I caused that trauma to him. But ultimately, we have such an open relationship that we could have the hard conversations, and there wasn't any fear of repercussions. Like, we both just genuinely want to have what's best for each other. And he supported me in that. Like, the day came, I'm like, I'm just really tired of this. There's other things that I want to do. He would take me out to like go mountain biking and go to national parks. And it's something we still do and we love very much. But while I was still using opiates pretty heavily, I couldn't take those longer trips because I would get sick. So we would go like on these day trips, and he'd be like, well, let's go like mountain biking for the weekend. Let's stay in the Allegheny. And I would have to decline because I couldn't leave the proximity of like Northeast Ohio for that long a period of time because I would start to go into withdrawal. So my desire for wanting to do new things like that outgrew my desire for wanting to continue to use drugs. Like, just being exposed to new things that I hadn't been exposed to. Like, no one had ever taken me mountain biking before. And I was meeting all these new people who were really exciting and doing these really fun things with their lives. And I wanted to be a part of that. I wanted to be included on those trips and hanging out with new people and going kayaking. And over time, like, it definitely wasn't overnight, but over, you know, time, it started in the back of my mind, like, you know, this is really getting old. But it took some time for me to see that and how it was going to play out. And I really had to think about my future. So when the day came, my boyfriend, he's like, what are we going to do? Are you going to keep, you know, doing this? Because I can't do this to myself. And we just kind of sat down and talked it out. And he ended up driving me to a detox facility in Canton. I got put on Suboxone, and I'm still on it today. And I haven't looked back since then. So like, it really takes like an open and supportive person. And that's why I think it's so important that people get familiar with different types of language and motivational interviewing and an open communication, because like, it really does open the door to have better relationships. And when we have better relationships where there's trust and authenticity, then we can talk about the things that we actually need instead of being focused on punishing people. So it's a lot, but.
Yeah, absolutely. I appreciate that. Yeah, I definitely identify with a lot of what you're saying. And I think it kind of goes back to Dr. Viscaro's, slides about pre-contemplative and contemplative, because, within my own substance use disorder, I definitely had those pre-contemplative times of, no, I'm, like I don't need help, but in the back of my mind, I did know that there was a problem, right? So then, moving in to that state where it continues to get worse, and the just kind of what you said, like the desire to get better instead of the desire to keep doing the same things that we're doing, outgrew that. And it's a long and complicated process. But it's, the fact that there are so many resources out there, like Dr. Bhaskara had said, is so great. So Charles, what do you feel would have helped you, like if a medical provider or, someone in a related helping profession asked you about your substance use? How do you feel that they could have built trust with you?
I think that, trying to summon that mindset of active addiction, I think so much of it is you're trying to avoid consequences, right? You're trying to avoid getting in trouble. And so providing like a safe and trustworthy environment and relationship where you feel like you can be fully honest, because there's not a lot of honesty that goes on with folks that are abusing drugs and alcohol. And so most of those closest relationships in our lives, whether it be a parent or a sibling or a close friend, we don't feel like we can be fully honest with those people a lot of the time. So if there's a medical professional or someone in that realm who I feel, it's safe to talk about and be fully honest, in the back of your head, like you're always looking to like offload this stuff. I mean, you don't feel great about it, yet you do it anyways, right? So I think just establishing that rapport where, you feel like you can trust the person you're talking to, that is privileged information between you and that individual, that their only purpose is there to be supportive and helpful when you're ready to receive that help. Anything that can be done to just like support that environment, I think those are the priorities, from the perspective of the person having that conversation with the addicted individual. So.
Yeah. And so what type of recovery supports do you feel are helpful for you? And are they the same when you first reached out for help, or have they changed at all?
Well, I think for me, initially, I needed like something more formal, like a treatment, experience. For me, I did an outpatient treatment, but a lot of folks really need that inpatient in order to fully detox and really develop themselves in that recovery lifestyle. And then supportive of that, in my own experience, supportive of treatment was also a 12-step program. And so that was sort of both part of the initial phase, and then is also really comprises the ongoing recovery work that I do. So for me, it's about, you almost need something to kind of shock your routine and sort of your lifestyle initially to kind of pull you out of it, clear everything out of your system, and like start to establish some good new habits. And that can look differently for a lot of people. It can go everything from an inpatient that transitions to some kind of like housing, recovery housing. For me, it was not quite that extreme, but there's a whole gamut of what that looks like. And then, just maintaining it is all about finding that recovery community, finding that support network where you can continue to reinforce those messages and reinforce the tools that we learn, and then also be in a position to like give back and help other people that are struggling, because that's really an instrumental piece of maintaining long-term recovery.
Yeah, that's wonderful. I really appreciate, as someone in recovery, that there are so many different types of supports, resources out there. And I think, for my own recovery journey, I, had a certain idea for a long time in my recovery of what recovery was supposed to look like. And I appreciate especially the, this prevention education subcommittee that I've been the secretary for a few years, us having these conversations and panels with the community has just been so helpful to see that, each person has a different recovery path, and, what works for one person is different for someone else. And yeah, I appreciate continuing to learn. So we're now at the point where we're gonna open it up to those of you online for questions. So Jody had put in the chat that you can, ask questions there. I also am gonna, give a prompt to see if, to ask you all, we know that this is a very difficult conversation, and what do you feel that there are some challenges and roadblocks that people put up, people who have substance use disorder put up. So,
Sure. So if anyone has questions, please come off mute, or you can chat them in the chat box and we'll be glad to ask.
I think also while we're, I was
just gonna say while we're waiting on that, I wanted to just kind of follow up on a couple things. I think that was kind of a real great dialogue to listen to. As you asked, it was a couple of questions ago when you were just kind of asking about, you asked Charles about like what was helpful to you. I started thinking about like being a provider. I wrote down a few words, and I wrote down time. This is time, patience, pace, persistence, and flexibility. And the reason why I wrote, and it's funny because it's interesting. Like I heard that in a lot of those responses. And by time, I mean like this is a nonlinear process, right? It's time unlimited recovery, right? As a provider, being patient important. Pace is important. If you try to ram interventions down someone's throat, it can really leave a bad taste. And a lot of trauma, as Ashley mentioned, people can be re-traumatized. So like time, patience, pace, persistence are key, and flexibility, because not everybody is going to do it the way that we want to do it. The treatment world has gotten a lot better, but right, we still kind of kick people out, and we still do certain things that just are so unhelpful to the overall process, that what everybody was saying really needs to be sort of like, put in a little bottle, and sort of, everybody needs to keep it and open it when you're getting frustrated, when you want to kick somebody out of treatment, or whatever the issue might be, is because it's important to remember that, right? So anyway, I just wanted to kind of highlight that for really for everybody that might kind of be listening. And the thing about kind of like what's out there, resources, I always kind of say there's something out there for everybody, because people will be like, oh, I don't like AA, or I don't, oh, there's smart recovery, and there are multiple pathways to recovery. People, it might be their sober support might be an art group, it might be a coffee shop, it might be, right, there are just so many different things, right? Recovery doesn't have to look, as you pointed out, Karen, a certain way. It can look your way, and finding that thing or those things are kind of key and important. So yeah.
Yeah, thanks so much, Dr. Biscaro. Ashley, I see that. Got your hand raised.
Yeah, thank you. So I was thinking about the question of like what, I forget how it was worded, but like what would have helped with building trust while we were actively using. think it was something along those lines, but it made me think back, like some things that Charles said really like opened up like some things that I forgot in my brain that I kind of like blocked out, like thinking back to the many times that I was in treatment and voluntary treatment, both voluntary, involuntary, women's homes. I was in different types of like faith-based programs. And I don't know, just thinking about all these different interactions that I had, whether it was probation, the police, treatment providers, peers, sponsors, like all of these different interactions that I had while I was actively using drugs and like making attempts to be in recovery. Like not one time did anybody ask me if I knew what an overdose looked like or what to do if someone overdosed. No one asked me if I had Narcan or knew how to use it. And in fact, like I didn't even know that was a thing that existed that we could have. I truly didn't know what paramedics were doing when they arrived on the scene to, take care of someone who was overdosing. I didn't know any of this. And I think that could have changed a lot of my timeline, like my trajectory. When people, there's actual like data on this too by the CDC that says when people are exposed to harm reduction methods, whether it's like tangible things like Narcan and sterile syringes, or whether it's like a conversation type approach by a provider, like people are 5 times more likely to want to engage in recovery than if they didn't have access to harm reduction at all. And I think that's fascinating because I tried so many times to do abstinence. I tried actually like a different type of MAT early on, but that didn't work. And there was just a lot of stigma coming about like MAT and different pathways. And this is like in the 2010s. There's just a lot of misinformation out there about MAT. It was still kind of newish. So I was just hearing a lot of misinformation and I wasn't actually getting my needs met. No providers asked me if I needed to see like primary care or if I had like mental health concerns. It was more centered around like my use and getting me to stop using rather than thinking about like, do you have somewhere to sleep at night? Have you seen a doctor? Like all of these other things. And, now today I know I had undiagnosed ADHD. Like I was using drugs as like self-medication and coping mechanisms. Like I was truly self-medicating and it just kind of like progressively got out of control. Like there was no one that I could talk to about this stuff. And when I was in front of a provider, it was, like I said, just focused around abstaining rather than thinking about what I actually needed. And like Dr. Piscaro said, like that actually really did traumatize me because I knew that the next time I went in front of a provider, it was going to be a repeat of the same thing where I'm going to have to like suffer through this and just kind of like, I don't know, go with the flow of whatever they said until I got out of their face and then I could do what I wanted after the fact. So like, I really didn't want to be there because I wasn't getting my needs met and I just didn't know how to articulate that at the time. Just kind of frustrating now because I met some really good people. I still absorbed a lot of that information though. Like I remember the things that I learned while I was in these treatment facilities and these different sober homes. And I'm really grateful for the people that, tried to help me where they could and teach me different ways of interacting with people and just better relationships. But it like just wasn't what I needed at the time. No one was willing to ask me like, when you leave this facility, do you have a home you can go to? Like, do you have a safe space? Like, what can we do about that? Because that's what was on my mind. Like, where am I going to go after this? So yeah, I think it just kind of reiterates the point of like, when we're meeting people where they're at, it's literal. Like we really need to be focused on what the people need and not what we want them to do for us.
So we do have one comment. Thanks, Trey. Trey says, with the increased focus on the importance of harm reduction, there seems to be a willingness to allow folks to use harmful substances as long as they're being careful. So how do you handle someone who continues to use because they are able to remain functional in their life and haven't hit bottom? Is it just a case that they're ready or when they're ready and keep supporting until that point? Does our panelists have any thoughts on that? Very good question, Trey.
I got some initial thoughts.
Go ahead.
Yeah.
Just off the top. So I want to make sure that I'm addressing this. So with the increased focus on the importance of harm reduction, there seems to be a willingness to allow folks to use harmful substances as long as they're being careful. So with harm reduction, the first principle of harm reduction, like the pillars that make up what it means, is that we accept, for better or for worse, that drugs are just a part of our world. They've been here since the dawn of time. Like, ever since there was humanity, humans have been using drugs for different purposes in different ways, whether it's like a ritual or pleasure, self-medicating. Like, there's so many reasons why people use drugs. And harm reduction is about acknowledging that they've existed since as long as humanity has. And instead of trying to like delete them out of existence, it's recognizing that would be impossible to do. And drugs will be here. They're here now, they've been here, and they're going to continue to be here. It's just up to us to decide in what way do we want to coexist with drugs. And for a lot of us, we can look to different examples of drugs that we use in our daily lives, but we just don't consider them drugs. Alcohol is a drug. Nicotine is a drug. Caffeine is a drug. We get medications from pharmacies. Those are drugs. It's just the ways that we use them, the ways that they're regulated. They're produced, manufactured, they have labels and ingredients. We know what they are. But when we criminalize a drug and put it on the street, then that's where it becomes dangerous. So I just wanted to address that. And the way that is worded, willingness to allow folks to use harmful substances, they're only harmful because they're on the street. And I kind of want to address just harmful substances in general, because all drugs can be harmful for different people with different relationships to them. So they all have the potential to be harmful. So there's not like quote unquote good or bad drugs. There's just drugs, and we all have different relationships to them. It's a spectrum. And I have more like documents and resources on this too that I can share to follow up after this if people want to read more about that spectrum. So how do we handle someone who continues to use because they are able to remain functional in their life and haven't hit bottom? Not everybody is going to have a rock bottom. And honestly, rock bottom is just like subjective. It's different for everybody, and not everybody is going to have it. Like, my lowest point that I thought was my lowest point wasn't my lowest point, because there was always something else. And I think that we shouldn't be waiting for people to be in a low point to offer them resources. I think we just give them the resources. And I think if people are functional, I think that's okay. People use alcohol every single day and they're functional, right? Any of us could have like, well, not me and Charles, but anybody could have a drink, right? And not everyone is going to end up with a disordered use, right? Oh, right, Karen too. Not everybody is going to end up, with an alcohol use disorder or a substance use disorder. So if you know someone who is using alcohol or any other type of drug and they're functional, they're fine, they're working, they're happy, they're healthy, like, that's okay. We don't need them to suffer to be able to help them when they need it or to have a good relationship with them. Does that make sense? Not everybody is going to have a disordered use. Some people can use drugs casually, just like people use alcohol casually, or nicotine or caffeine, etc. So I would just say, if people are ready and if people actually have a chaotic relationship with drugs, then that's when you have the conversation. Like when it becomes unhealthy, when it becomes to like, when it comes to the point of them having their lives disrupted by it. So like for me, I was living out of my car at one point. Like that's a problem, right? So there's signs that you can look for. But until then, no, just be supportive and have a good relationship with folks. And I apologize, I took up so much time, but that was a really good question. I really appreciate that question. So kudos for thinking about that and asking.
We have another question too for the panelist. So Kevin from the VA was talking about the VA services, and oftentimes individuals ask for certain levels of treatment, and just making sure that the most appropriate type of care and treatment is provided at the right time. How would you all on this panel discuss this with persons seeking treatment? We do not want them to go away and not accept treatment. So when you're trying to work with an individual, this might be a little role play. How would you discuss like the levels of care, making sure like if they wanted residential treatment, but that isn't exactly what they need, they might want residential treatment for other reasons to escape, but ensuring they're getting the right care at the right time at the right place. I hope I reiterated that correctly, Kevin. Kevin, if you're online, you can come off mute too. Well, unfortunately, he says he can't come offline. He doesn't know how to unmute. Sorry about that. Oh, it's grayed out. There must be a setting that everybody's muted. Sorry about that, attendees.
I think that's a really fantastic question as somebody who also worked at the VA. I think, and this is kind of something I was getting at, sometimes our system and structures, the systems and structures that we have in place work a little bit against us. And there are a lot of different reasons for that. And I understand some of the reasons that Dr. Smith is kind of pointing out here, right? You have a limited kind of resource that a lot of people want. And so kind of how do you help them navigate through that? But I look at these reasons and boy, doesn't that sound a lot like social determinants? Doesn't that sound a lot like how do you support somebody, and get those, needs met in ways that doesn't involve, residential treatment. I'd be curious, but I mean, if somebody were I'd want to know how do we meet these needs in other ways, right? These are, and try to find out from them sort of, all right, residential treatment's the kind of what they want. We can't get that, but they obviously want help, right? And so what are some of the ways that we can get those other needs met? Yeah, I mean, and then I think, I think that kind of the other folks that have kind of experienced this would probably have even more to say about that. But I think, what other resources are available, right? How do we get those primary needs met and also keep people engaged are pretty critical. So I think it's a really good question, especially when we feel like, and I have also often felt like kind of the system is sort of working against us. I've worked with people who have been court involved who I'm working with them and they all of a sudden they don't go to their 3A meetings. So now they're back in jail and it's like, what the heck, like we've totally undone a lot of what we were doing by doing that sort of thing. So
Kevin's now online. He's wanting to respond to you, Dr. Viscaro.
Can you guys hear me?
Perfect.
Yeah. Okay, so I appreciate this is a very interesting discussion. Good talk. Dr. Viscaro gave the exact kind of answer I would have given. I actually, my focus is really on the 3 persons in recovery. What I was interested in is as being persons in recovery, peers who've gone through this. First off, how would you have this discussion with someone who presents to you for the first time? And then second of all, how would you, at the beginning of your own recovery, handle it when you get up the courage, you go in for treatment, and maybe you had in your mind, I'm going to get this treatment, and they offer you something different. Are you going to be able to accept that? Are you going to walk away? And again, those are the dynamics we deal with. And as Dr. Pescaro mentioned, we have to look at the ethics of the situation, the justice. We get 1,200 consults a year in our addiction program here. That's like 100 a month. And a lot of veterans need residential level of care or a specific level of care, and others may desire that, but they haven't tried anything and their substance use doesn't warrant it. And so then there's the potential they could just walk away. So again, I was just trying to get some feedback from those who have actually lived this experience.
Yeah, Ashley, you want to go?
Yeah, thank you. Thank you so much. I absolutely love this question because it's something that I feel like a lot of folks don't even think about. Like, it's not even in, I don't know, people's peripheral vision, like, at all. So I actually experienced this. My second to last overdose that I had came after I had been in recovery for a year. So I was abstinent for a full year. I relapsed, I overdosed, woke up, and my partner was like, okay, so what are we doing about this? And I'm like, okay, I'm already on the phone. I'm looking for different treatment. So this is a long time ago, of course, but the places I called, I just Googled, like, what do I do? And looked up places near me. And Google is a mess for recovery resources. It is awful. But I went down the list and I called all of them. I didn't even know what most of those words meant. Partial hospitalization. What is this? Inpatient. I didn't know what those were. But I called them all and I told each and every one of them, like, my situation. Like, I need some kind of treatment. Like, what do I do? I wanted to be inpatient somewhere. Like, even though I had used one time in a year and immediately overdosed, my brain told me that this is an awfully big red flag, and I need to be living in somewhere to build better skills, to learn new habits. And I wasn't doing that by myself. So I needed to be around people that could model that behavior to me and that could teach me how I needed to live and not overdose again, not relapse again. And I was told no multiple times, that I didn't meet the criteria. And it was devastating. It was devastating because I had that period of abstinence that year. Even though I had overdosed, I was denied. And it was really frustrating and disheartening. It made me want to give up. But luckily I found Glen Bay, which they have outpatient. I got a better idea of what it was, and I went through that program. So even though it wasn't what I wanted, I made a compromise. And that was only because someone was willing to sit on the phone with me and explain all of this stuff. They sat there and they explained it. It was literally over an hour-long phone call. I sat there with someone, and that was after a handful of people would just tell me no, like, no, you just don't qualify. That's not how this program works. So, like, there were a lot of really harsh people out there, but it just took that one person to help, like, translate all these words and explain what they are and explain why, like, you don't need to be, like, inpatient. You don't need this. But I really wanted some kind of residential. That's not what I got, though. And I also see this on the other end. So now I'm working at a syringe program and I meet people who are in these situations. And what we end up having to do is the same thing, where we have to explain the different programs and we have to make compromises. So if people can't find, like, if we can't find a program in Cleveland, we start looking outside of Cleveland. We literally have to take people to, like, Youngstown and Niles, to, like, New Day Recovery. Like, that is pretty common. But it is really frustrating. And this goes back to, like, structural stigma, institutional stigma, where there is not enough funding for the things that we actually need, because the people who hold positions of power over the funding believe that we have everything that we need already. Like, oh, you got, like, one good program in Cuyahoga County for veterans. You don't need any more than that. That's okay. or they just don't allocate enough funding for the program to expand or exist or increase capacity. This all roots back to stigma, but in the meantime, it really has an impact on our day-to-day and how people get the appropriate level of care. And there's still a lot of there's just a gap in information where people don't know what it is they need, because we exist in a society that tells us that if you use a drug or if you use alcohol, you automatically have a substance use disorder / addiction. Everybody thinks that, and they don't know how to appropriately respond to it. They don't know how to decipher it for themselves. People think that they have a worser problem than what it is, which ends up clogging our system. And this is why it's so important that we understand language and change the language that we use and be literal when we're using these terms like addiction and substance use disorder and drug use, because drug use doesn't equal substance use disorder. And we have to teach people that to filter out who needs to be in this program and who doesn't need to be in this program.
I would just jump in to say that it's good to hear that you had somebody who was able to take the time and explain the reason why, and you found that person. I mean, in our intake huddles, when we discuss these kind of cases, sometimes people will roll their eyes or get frustrated. We do these on video when we know that all of a sudden we got Charles Sackman again. It's like, really? And again, this is just so you understand. But when we meet with the person, all that goes out the window. And we're fortunate because here at the VA in our VARC program, and I know Dr. Mascaro worked with us, a lot in the past, most of our staff are very dedicated to working with persons with substance use disorder, alcohol use disorder, gambling use disorder, and they want to work with veterans. And so people are able to sort of put that aside. It's like kind of a free space in our intake huddle to discuss. But when we meet with the person, we really do try to convince them, this is why we think you need to try outpatient first, or this is why we think outpatient hasn't worked in the past, and this is why we think you need to be in residential this time, because it goes both ways. But anyhow, I appreciate that the whole panel, but especially the three of you who are in recovery, that you're willing to talk about this, because one of the things, we have a very good peer in our VARC Veterans Addiction Recovery Center program, and I wish we had more, because I really do think, especially with the MI piece, you guys have built-in cred that a lot of our people coming in the door, especially for the first time, they need to hear that.
Yeah, thank you so much, Kevin. I just wanted to give Charles an opportunity if you wanted to share a little bit about your treatment experience.
Appreciate that, Karen. I hesitate a little bit because my particular experience is a little bit different. So I really try when I speak about recovery to speak from my own personal experience. And so, I think the broader takeaway is, for me personally, when I was ready to do something about my addiction, I was willing to compromise a little bit. I was willing to put in a little bit of extra legwork on my part to go out and get that. And that's just my personal experience. And I would hesitate to emphasize that too much, because I do agree with some sentiment that Ashley shared. Like, we don't need to wait for people to get so bad that they're just completely desperate. Getting people to turn their lives around is a good thing. And so we don't want to discourage that. So I understand kind of where you're coming from and the dilemma you're describing, Kevin. And I think, the hope would be that the folks that are having those conversations are like the folks that Ashley spoke with at the treatment center that she described, Glen Bay, which consequently is where I went to. But so that they can just explain, like, this is the support you're going to get with the alternative, and this is what's available right now. And so if you're going to do something about this, this is the path we have. And for me, like, a little bit of a roadblock wasn't going to stop me from doing something to help myself at that point, because I wanted to help that badly.
Thank you, Charles. Are there any last questions as we wrap up? Now that you're all able to unmute yourself? Well, we greatly appreciate the perspectives and the experience. Oh, I see Trey says, I've been on some of these calls and webinars before with hundreds of people. And at the end, I wished I had time back. Today, I wish we'd have a couple hundred people in attendance. Great conversation, so helpful and informative. Thank you, everyone. This is just another thing that makes me proud to be from Northeast Ohio. Thank you, Trey. That's really great. Thanks for sharing. So I agree. I think the perspectives of the people with lived experience, we really need to seek that perspective, especially when we look at policy changes, when we look at educational materials, when we look at outreach efforts to really engage people with lived experience. You brought up a lot of good points about trust, how we speak with authenticity, how we listen. So just very good reminders. Thank you all from the panel. Appreciate that very much. Just to wrap up with our consortium, our updates we like to give each time we meet together with these educational seminars. So the Center for Health Affairs, as a partner with the OD2A local work in Cuyahoga County, we have convened focus groups of people with lived experience who use opioids for their chronic pain management. And so we're seeking advice from them, seeking information about what would be helpful, what they have found helpful, how they speak with their clinician and providers. And so we had 3 different groups, 12 people total, who participated in this, and we will be writing up a report for the OD2A local grant, probably first quarter of the next year. We plan on having more of these educational series, so we're seeking now, we're lining up our calendar for January, March, May, and July. We used to do them quarterly, now we're doing them every other month, just to continue to have these informative dialogues with the community. We have the Consortium Chronicle newsletter. If you don't currently receive it, there's the QR code that you can scan and sign up for the newsletter. This newsletter is put out on a monthly basis at the end of every month or the first week of the new month, and it recaps any policy updates, training updates, announcements from the government, just to keep everybody on the same page and informed. So feel free to sign up for that. And previous issues, we have now cataloged those on our Opioid Consortium webpage. On the left bar side, there's links to our past issues of the Consortium Chronicle. Not chronic. Sorry, I just noticed the typo on that slide. And so again, just thank you. Just make sure we don't have any last minute questions, comments from the gallery. This has really been informative and appreciate everyone's participation. We look forward to sharing this recording as well. It'll be in the next Consortium Chronicle newsletter. We'll put the links to that. So thank you very much for all of your time and your valued perspective.
And Jody, I just real quick, Ashley just threw in the chat, if anyone's interested in learning more about stigma, the overdose crisis, and harm reduction, she is going to be presenting for a free webinar, and the link is in the chat there. So thank you, Ashley, for sharing that.
Yeah, thank you. Another opportunity. I always learn something new each time we talk, so it's really been great. And we also have, thank you, Rachel, posted in the chat a survey. So as part of the OD2A local grant, we are evaluated on the work and our programming. And so if you wouldn't mind taking that brief survey, as an attendee today and help inform our future program efforts in education. Thank you. Well, we will conclude this session for today, but we appreciate everyone's participation. Have a great day.